When you're in a hospital, all you're really thinking about is getting better, right? But have you ever stopped to wonder who's focused on keeping you safe? Well, it turns out there's a whole science dedicated to exactly that. Today, we're going to pull back the curtain on patient safety, the systems, the culture, and even the partnerships that are all designed to protect us when we're at our most vulnerable. So, let me ask you straight up, how safe is your hospital? It's a big question, and honestly, maybe a little unsettling to think about. But that exact question is what drives an entire field within healthcare. The point here isn't to make you anxious. It's to show you how safety is literally woven into the fabric of modern medicine and to empower you with that knowledge. Okay, so to really get a handle on the solution, we first have to understand the problem. And in healthcare, that problem has a name: preventable harm. This is the challenge, the hidden danger that the entire concept of patient safety was created to fight. Now, the key word here is avoidable. This is so important. This isn't about blaming a good doctor or nurse for making a mistake. We're all human. Patient safety looks at the bigger picture, at the system itself. It starts by admitting that, yeah, errors are gonna happen. So the real question becomes, how do we build a system so strong that those human errors don't actually cause any harm? All right, so if preventable harm is the threat lurking out there, then patient safety is the fortress we build to protect against it. It's this active, organized effort to defend patients and make sure they get the best possible outcome. Let's dig into what that means officially. What this definition is really telling us is that patient safety is proactive. It is not about just crossing your fingers and hoping for the best. It's a constant, systematic hunt for risks, both big and small, with the goal of basically engineering them out of existence until the chance of something going wrong is as close to zero as humanly possible. So how do you actually build this fortress? Well, you start with the blueprints, the design of the system itself. The main goal is to create a system where the safest choice is also the easiest choice. And that's where these foundational, systemic pillars of patient safety come into play. First up, the most fundamental principle of all: preventing errors before they can even happen. The philosophy behind this is actually pretty simple. Make it super easy to do the right thing and really, really hard to do the wrong thing. It's not about relying on people to be perfect all the time. It's about building perfect systems around them. For example, take giving medication. A simple checklist like this is a perfect example of error prevention in action. This isn't just a friendly reminder for the nurse. It is a hardwired, mandatory process. It forces a pause, a moment of verification at a critical point, which makes it incredibly difficult to make a mistake. That's smart, simple, effective safety design. This brings us right to the next big idea: standardization. Think about it. If every single doctor performs a common procedure in their own unique way, the chances for an error just multiply like crazy. But by creating one standard, evidence-based best practice, you introduce consistency and predictability. And that is an absolute cornerstone of any safe system. Of course, we're living in the 21st century, so a huge part of system design is technology. You can think of it like the smart wiring inside our safety fortress. Automation can be an incredibly powerful backstop, designed to catch potential human errors before they become a problem. And here are some examples you might even see yourself. Scanning the barcode on a patient's wristband and then on their medication to make sure they match perfectly, or using electronic health records that automatically flag a potential drug allergy. These technologies aren't just there for convenience. They are vital safety tools that are built right into the daily workflow. But even the most brilliantly designed system will run into errors because these systems are operated by people. So the next set of principles is all about that human element and how a truly safe system has to also be a learning system. We all know this saying, right? To err is human. It's just a fundamental truth. We all make mistakes. We're fallible. And that leads to the critical question: what happens when that very human thing, making a mistake, happens in a healthcare setting? How an organization responds to that error pretty much defines its safety culture, and ultimately, how safe it is for you. This slide shows this massive shift in thinking. See, the old way was what we call a culture of blame. You find the person who made the mistake and you punish them. Simple. But the modern culture of safety does the exact opposite. It doesn't ask who messed up. It asks, why did our system allow this to happen? And how do we fix the system so it can never, ever happen again? And a culture of safety can only thrive with one key element: transparent reporting. This means creating an environment where a doctor or a nurse can raise their hand and say, "Hey, I made a mistake," or even, "I almost made a mistake," without any fear of being punished. Every single one of those reports isn't a failure. It's a priceless piece of data that makes the entire system safer for the next person who walks through the door. So, we've talked about designing the system, and we've talked about the human culture. But our fortress of safety has one more critical element, and that is partnership. And this is where everyone, including you, the patient, gets to play a role. Let's start with nurses. They are right at the very heart of patient safety. Think of them as the frontline guardians. They spend the most time at the bedside, and they are constantly monitoring, coordinating, and advocating for their patients. Their watchfulness is an active human safety net. This slide really pulls it all together. You can see how a nurse's job embodies every single principle we've just talked about. They follow the standardized protocols from the system's design, they advocate and report issues as part of that safety culture, and they are the communication hub for the whole care team. They are, quite literally, patient safety in action. And that brings us to the final crucial piece of the puzzle. The most underutilized safety resource in any hospital is often the patient themselves. An engaged, informed patient is a huge asset to the team. You are a partner in your own care. Now, this isn't about being a difficult patient. It's about being an involved patient. Don't ever be afraid to ask something like, "Can you just tell me what this medication is for?" Or even, "Excuse me, did you wash your hands?" If a care plan doesn't quite make sense to you, ask them to clarify. And most importantly, if something just feels wrong, speak up. Your voice is a powerful safety tool. And that, right there, is really the core message of all of this. True patient safety isn't just one thing. It's the powerful combination of all three: a well-designed system, a learning culture that gets rid of blame, and an active partnership between you and your healthcare team. So, I'll leave you with this final thought. Being a partner in your own safety starts with asking just one simple question. So think about it. What is one question you're going to ask at your next doctor's visit? Because an engaged patient isn't just a safer patient, you're a crucial part of making the entire system safer for everyone.